the rate of U.S. high school students reporting chronic feelings of sadness and hopelessness rose 65% over a decade. We've got Dr. Aimee Duffy here, along with her daughter Maddie, whose own struggles included thoughts of suicide, and of course, Maddie's service dog Katie is here too. Welcome to y'all. I'm glad you're here.
Thank you so much.
You've published a book, Why Can't She See Me? And the goal is to help others by sharing your experiences. So, Maddie, at age 13, your depression battle included some signs that even your mom, who knows all about this stuff, wasn't seeing right away. So we want to go through those signs. The first, you said, is lack of motivation. What was happening?
Well, I didn't want to do anything, whether it was hanging out with my friends, sports, or even just going to church. I wanted to lay in bed and do nothing all day, every day.
Yeah.
So that was definitely coming from someone who always wanted to be with my friends and playing sports. It was definitely a noticeable difference in my behavior and what I was doing.
You just kind of check out in that way. And then that lack of motivation extends into social withdrawal. Dr. Aimee, what did that look like from a parent's perspective?
Yeah, Maddie was just always in her room, and teenagers are starting to do that a little bit, so it's hard to tell exactly is that a concern, but in her room, on her phone all the time, headphones, hoodie, you know, hiding, not wanting to be part of the family unit at dinner time and things like that.
Which
so
sometimes can feel
different.
like, well, that's what kids do,
yeah.
right? A change in sleep patterns, you said, is another big indicator that something isn't right. So, Maddie, what were you experiencing there? How did your sleep change?
Well, I started going to bed at 1, 2, sometimes even 3 or 4 in the morning, and I would sleep all day the next day. I would fall asleep in class, but I would just sit there on my phone all night, never wanted to go to sleep.
Yeah, just kept going and going.
Just kept going and going.
Loss of appetite was another factor. Dr. Aimee, that's something you can see. You said when you look back, that was one that was more obvious.
Yeah, I mean, we had 4 kids, so everybody had their lunches lined up, and, you know, Maddie stopped wanting to take her lunch to school. We'd have breakfast ready in the morning, and she'd just always say, I'm not hungry, I'm not hungry. Just definitely a change again from the normal, you know, teenager behavior. You know, even though they're not boys, they're still, you know, growing teenagers that ate a lot.
And then maybe this is one that starts to jump onto people's radars a little bit more visibly when there's the decline in academic performance. What was happening with your grades? What was the difference there?
Well, I went from being a straight A student to having 3 C's and a low A from my 7th to my 8th grade year. It was crazy.
Yeah. So yeah, that, you know, a lot of things to look at. And then even personal hygiene, that's another one you hear about. But you were having to tell this grown-up kid of yours, get in the shower, brush your teeth, do the things.
I mean, I'm still bathing her younger 2 sisters, you know, every night, and kind of had gotten over having to tell Maddie what to do. She was normally in the shower and doing her own thing, and she'd come up and hadn't taken a shower. Did you put deodorant on? Brush your teeth, brush your hair. You know, I started noticing I had to kind of remind her again about taking care of herself.
All right, so these are, you know, these are the signs, and you write about this in your book. But now, here you are, service dog alongside, you know, is there anything you wanted people to know about that journey that you went through? Did it take some big traumatic event, or were you just feeling depression? Were you just going through a lot?
There was definitely some traumatic events, but I guess my best piece of advice to someone who was feeling like how I was feeling is to distract yourself without shoving those feelings down. Go for a walk, take your dog for a walk, go get some coffee, talk to your dog. This dog saved my life just by talking to her, and service dog or not, she wasn't one when she did save my life. So
dogs do amazing things for people. And for anybody who wants to learn more, your book is on Amazon. We're going to have information on accesscarolina.com. Anything else before we go on this important topic this month?
Well, this is really just an important story, and our book is about the experience that Maddie had when she did have suicidal thoughts and came to me asking for help. And unfortunately, our mental health system, whether it's for kids or adults, is not, you know, really set up to get us better, you know. And so part of our mission is to let the parents of these kids see, you know, these signs and try to take, you know, some major role in moving towards a better life for your kids. And same thing for the kids to recognize maybe, or for friends, you know, hey, I'm noticing my friend having some of those signs. Maybe I should tell an adult so that something happens before they get to the point where they're in a traumatic situation in the hospital, or even worse. I mean,
that communication,
you know, if we can just save one life.
And that communication is so crucial. You must be just grateful that you two have the relationship where you can talk, but, you know, everybody should be talking about this, so we like to put that information out there. Dr. Aimee Duffy, Maddie Duffy, thank you both for being here. We appreciate it.
Thank you.
You too, Katie. In the book, Why Can't She See Me? That's available on Amazon, and we'll have that information on accesscarolina.com. And we also want to remind people that, anyone in need of help, it's available. If you or a loved one are struggling, you call the National Crisis Lifeline is one option by dialing 988. It's available around the clock. And our Fox Carolina News Department has also put together a list of mental health resources in our area. You can just visit foxcarolina.com for that. Click on the community tab, and then you look for the link called Upstate Mental Health Resources.